Hello, everybody, and thank you so much for joining us today for our Park Nicollet Foundation Annual Updates Coffee and Chat. We're so excited to have you here, featuring our very own Executive Director, Hayley Mueller. And with that, I would just love to kick it off to Hayley. Thank you so much for presenting today.
You bet. Of course. Thank you for having me and welcome everyone to the Coffee and Chat series. So today I'm going to just walk us through kind of a Park Nicollet Foundation 101, if you will. But first, I thought I'd give a little introduction. So as Abby said, I'm Hayley Mueller. I have the privilege of serving as Executive Director at Park Nicollet Foundation, and I have been in my role for a little over 6 months. So I am still brand new and learning so much about not just Park Nicollet Health Services, but also the work that the foundation does in community. So I come to Park Nicollet Foundation from YWCA Minneapolis most recently, but I spent the bulk of my career in fundraising at Catholic Charities of St. Paul and Minneapolis. So I tell people I've been healthcare adjacent, but this is my first experience directly in healthcare, and it's just been a tremendous experience thus far. I've learned so much and still have so much to learn, but know that the impact of the foundation is certainly significant. So I thought we would start off today with a little celebration. We're winding down our 50th anniversary year. So I'm excited to share first and foremost with all of you today our 50th anniversary video. So I will get that queued up and then we'll kick it off from there. Oh, well. So I don't know what's happening there, but I will send out the video. We'll send it out separately. That's okay. We're nothing if we cannot kind of fly by the seat of our pants here. So we will send out that 50th anniversary video to you as part of the follow-up, but I can give you a little synopsis. So the video really highlights the tremendous 50-year history of Park Nicollet Foundation. We have been part of the community here in St. Louis Park for over 50 years, really impacting, again, both the internal community, but also our community partners and those out in the neighborhoods and areas surrounding Park Nicollet's footprint. So we're really proud of that incredible history and so excited about what the next 50 years has to come. As we've been saying all year, we are 50 years old, but we really feel that we're just getting started, and we're excited to share what the next 50 years will look like. So as a little overview, Park Nicollet Foundation works to improve the health and well-being of our patients, families, and community through partnerships and philanthropy. So we have the distinct pleasure of serving in a couple of different ways, both fundraising for Park Nicollet, but also giving those dollars out. And we do that both within Park Nicollet Health Services and in the community. So these are kind of the three main pillars of our work. So as I mentioned, fundraising. We have a team of folks who are consistently fundraising to bring new dollars into our system. We really view ourselves as funding the margin of excellence. So when you think about Park Nicollet Foundation, think of those things that aren't covered by insurance. Those we talk about it as, taking the excellent healthcare experience that our patients and families receive here and really making it extraordinary. What are those comforts? What are those small things that make a big difference? Like blankets, like prayer shawls, like just having a smiling face with our volunteer team. Those make a huge difference and make the experience at Park Nicollet different than what they might get other places. So we're really proud of that and proud to be funding that margin of excellence. But to do that, we have to fundraise. We have to have dollars to make those things happen. Additionally, we do a significant amount of grant making, and the vast majority of that occurs within Park Nicollet Health Services. So we're funding programs within our system, and that could be here at Methodist Hospital. It could be at any of our 50 primary care clinics. It could be at any of our specialty centers. We'll dig a little deeper into that too in a couple minutes. And then finally, volunteerism. I briefly mentioned that a moment ago, but we have an incredibly strong volunteer program at Park Nicollet Foundation. We are over 500 volunteers strong and growing, and have been really proud of sort of the resurgence of volunteerism after COVID. As you can imagine, lots of our volunteers were unable to be within our walls during COVID, but they have come back and come back stronger than ever. And that's really a testament to our incredible program here. So as I mentioned, kind of that two-pronged approach within Park Nicollet Health Services and then also Park Nicollet Foundation in the community. We are really proud of the partnerships we've built in community, particularly with school districts, with the City of St. Louis Park, and with other partners out where our footprint is. So we'll dig into that a little bit deeper here. So as we look at health services within Park Nicollet Health Services, this is just a smattering of the different areas that we support. So when you think of the foundation, again, don't just think of Methodist Hospital or even Park Nicollet clinics, but all of our specialties. So TRIA orthopedics falls under Park Nicollet, Melrose Center for Eating Disorders, Struthers Parkinson Center, the Jane Bratton Breast Center, Frauenschuh Cancer Center, which has our non-moving patient model, which is really innovative and different. We're also really proud of the International Diabetes Center. This is really a group that's on the cutting edge of diabetes care, and we're fortunate to be able to partner with them to bring some of their trials and studies to life. We also have a program called Caring for Colleagues, and I just want to call this out because again, as a new person coming into Park Nicollet, this program really stood out to me and speaks to the culture of health partners in Park Nicollet. So we have a fund here that supports our colleagues. So if we have colleagues who fall on hard times or something happens in their life and they need some financial support, the foundation has a fund that is specifically geared towards those needs. It's not often that you find an organization that has that sort of safety net built in for colleagues and for each other. So really proud of that, and to be able to provide that to our colleagues is pretty amazing. So if you can dream it within Park Nicollet Health Services, odds are really good that the foundation has touched that service in some way or has a fund that could. And then as we look externally, we think about our signature community programs. So a couple of those that I want to touch on today. We have Now Telemental Health. This is a program that provides telemental health right in our schools. So students are actually in their school, they go to a special room on campus and they receive telemental health. What's powerful about this is the exact same mental health care professional that provides services to my son. My son Jackson is 8 years old, and receives therapy and support from a Park Nicollet mental health care provider. That exact same therapist provides Now Telemental Health. So really providing access to high quality care inside the schools is what this program is about. We're about eliminating barriers. I am the first parent to call and make an appointment, and I want the 8 a.m. appointment or the 4 p.m. appointment. I don't want to have to pull my child out of school because it's difficult and it's inconvenient. So, but this program brings the service right to the school, which is pretty incredible. We also have our Growing Through Grief program. This is a 25-year-old program that again brings grief care and counseling right into schools. So we'll dig a little deeper into this as well later. But we are providing significant philanthropic support to make sure that students who are bereaved are receiving the care that they need in community. And then our school-based health clinics are our final signature program in community, and they are exactly how they're described. They are health clinics within school settings or very nearby. So we have full-on clinics where students can receive care for any kind of acute need they might have. They can also get immunizations, sports physicals, all of those things that, again, you have to take your child to an appointment. They can take their child right on site, and students can access those clinics themselves during the school day. Some other community programs that we have. So Stroke Inspire is a program that provides support and camaraderie for patients who have experienced stroke and really and their caregivers. So how do those patients figure out kind of what's next for them and be able to have an outlet and a care community that they can connect with. We are part of several health collaboratives as well, and the Good to Be Home program, which is also a partnership in community. And then finally, Mammo A Go-Go. You may have seen these trucks around town, and actually a couple of coffee and chats ago, we had Jessica Lang, who supports the Mammo A Go-Go program, come and speak. And if you'd like to learn more about that program, I encourage you to go back and view her recording. It's really incredible. But that program is big trucks. We have 2 of them that go out into the community and provide mammography to communities who might not otherwise have access. So we are providing interpreter services and all kinds of different services to make sure that we're catching diagnoses early, so that our patients can receive access to treatment that they might need, but really also trying to eliminate the fear factor and the nervousness that goes along with some of those diagnostic testing. So those are some, again, just a smattering of our community programs. So as we dig a little deeper, I wanted to share some stats with you. They're pretty staggering to me. And again, all of these programs are utilizing Park Nicollet healthcare professionals, so people that you and I would see when we go to the doctor. So in 2022, our school-based health clinics served over 3,200 patients and families, and over 4,100 healthcare needs were addressed. And those could be things as simple as, hey, I think that my child has an ear infection, to sexual health needs, to educating, especially our high school and older age students about their bodies and about different things that they might be experiencing, and having a healthcare professional provide that care. So we partner closely with our primary care partners to bring these programs to life. They're set up very similar to a doctor's office. So you can imagine that. Right in the school. So we're in Richfield, Burnsville, Brooklyn Center, and St. Louis Park. And again, these are on-site healthcare clinics. So this is the NOW program, and it lists here the school districts we're in. So Richfield, St. Louis Park, and Burnsville. These are our own behavioral health therapists, as I mentioned. We do have 2 languages spoken on our staff, which is great. We'd love to have more and continue working towards that. In 2022, we had about 52 students served, 744 hours of therapy. We know that children's mental health continues to be a significant concern in our community. And so Park Nicollet Foundation is really committed to bringing these services to schools. One of the pieces with this NOW program that's really important is having a partner within the school to help us be kind of the conduit for getting children out of class to come and do their services, but also explaining what the service is and really building those relationships. So we're continually working on that and bringing that to fruition. And then finally, again, is growing through grief. And I'll dig a little deeper into this program now. So we're in 16 school districts. Actually, now the number is over 120 school locations. So this program, again, is 25 years old, providing support to bereaved children. And the stats are really staggering of children experiencing loss within their nuclear family, their parent or their siblings. And what's even more staggering is how that loss is occurring. So historically, we saw a lot of that for medical reasons or natural causes. We're seeing the numbers go up in terms of violent deaths as well as death from overdose, which is an added trauma on top of losing someone. And so we're really seeing students in schools needing support for grief. And our teachers and faculty in our schools are not trained for that. They're ill-equipped to handle classrooms where they might have 1, 2, 3 children who are experiencing significant loss. And we know that having a program that's really upstream, helping young people to cope with loss, to talk about it, to feel like they're in a safe space to talk about it, will prevent a lot of significant challenges down the line. And giving them those tools to be able to cope is so, so important. So we have counselors who actually go out to the school They'll do individual grief counseling, but where they find the most impact is really in the group counseling. So bringing other students together who have experienced a loss of some kind and providing them with activities and different ways to channel their loss. So some of the best stories I have seen since I started are actually through art, and through really encouraging, especially the little ones, to show their grief through images. Again, last coffee and chat, we had Nicole Barnes from the Growing Through Grief program. So she dug very deeply into this program, and we're just really proud to be part of it and to be able to help support this incredible work. But I do encourage you to view that coffee and chat recording as well to learn even more about this program. So a little bit about our team. We thought it might be helpful to get a sense for who is the Park Nicollet Foundation team. So we have about 12 staff members who work on fundraising and operations for the foundation. And then we have 4 members of our staff who work in volunteer services. We're unique as one of the family of foundations within Health Partners that we actually house volunteer services underneath the foundation, which has created a really great partnership for us to kind of know what kinds of volunteer needs exist and how can we better support that. So as I mentioned, we have over 550 active volunteers. That number continues to grow post-COVID, and we have people doing countless activities. We've got folks who come in. You can see Pam and Coco on the screen here are caring canine volunteers. So we have canines who are here at Methodist Hospital. We have canines at TRIA, at Melrose, kind of all over our system. It's amazing what a little bit of puppy time can do to lift people's spirits. So we're proud to provide that. We have volunteers who assist with discharging patients. And I will speak to that really briefly because it is an incredible support to our frontline staff. Uh, Discharging patients takes time. It takes time, it takes energy, and it's a really important step in a patient's journey. But if we can have a volunteer who's well trained to do that, that alleviates pressure from our frontline care teams and gives our volunteers a chance to support. And so we're really proud that we're able to help all of our hospital staff, especially with that service. So our fundraising. So we have kind of 2 buckets. We have designated funds, or sometimes we'll call them temporarily restricted funds. And then we have our Area of Greatest Need Fund. Area of Greatest Need is exactly that. It can be used for whatever the greatest need is at the moment. Where our designated funds are more specific. So for instance, we have a fund for Frauenschuh Cancer Center, or we have a heart health fund here at the foundation. We actually have over 220 funds here, which is a lot of funds. And we're working to kind of condense that down to make sure that they're more usable for our teams. But we're really proud to have so much philanthropy that can help provide that, again, that extraordinary care to those who come through our doors. Another pretty amazing piece that I can honestly say I've never been able to say in my career is that every dollar donated to Park Nicollet Foundation goes directly back to our programs. Park Nicollet Health Services covers the cost of the foundation. And so every dollar that comes into us goes right back out, which is a huge gift and really an amazing story to be able to tell our donors and our funders that every dollar that they give is impacting a patient and family. And then just a quick note, our gift shop here at Methodist, those proceeds go towards our Service League grants, and those provide support to high school students in our volunteer program for college. So just another kind of full circle opportunity to be able to really engage the community. So in 2022, you can see the numbers down here. We raised about 3.3 million from 3,100 donors, which is pretty incredible. And then grant making. I talked about this briefly a few moments ago, but we give money mostly internally to Park Nicollet Health Services, and then of course to our signature programs, the Now Telemental Health, Growing Through Grief, and our school-based health clinics, and then also a few to external community members. So our giving is focused in 3 main buckets: patient and family experience, community partnerships, and then research and innovation. And then we give priority to different kinds of requests, especially if they have a direct benefit to our system, if they have a benefit to patients collectively, or they're new or innovative or differentiating programs of some kind. I will speak to one example that we have happening right now. We have to celebrate our 50th anniversary. We're doing 50 grants for 50 years. And these are 50 $1,000 grants that anyone in Park Nicollet Health Services can apply for patient and family experience. So we had one that applied for a little free library on their site. We've had one that applied for some funds to spruce up some artwork. So really trying to get the word out about the foundation, but also really encourage our frontline teams to think about what in their space, in their team, can they do to provide an even better patient and family experience. So that's been really fun, and that we're excited to report out to the community what we did with that, with those 50 grants in the new year. Just briefly, what we don't fund, very typical items here. But in 2022, we funded out $4.4 million in grants. And you can see the breakdown of those. Patient and family experience being a significant portion of those dollars that go out the door. These are a few examples of funds for contribution. So these are different places that people can give dollars. And again, this is just a sampling, but you can see all the different types of things and areas where we have funds that exist. So lots of the programs that I spoke about earlier, as well as, some specialty and new things. This myasthenia gravis program is newer and really an innovative approach to neuromuscular diseases. So lots and lots of different opportunity there. And then these are some new grants in 2023. So you can see again what kind of dollars are going out the door. We have funds for nursing education. We have funds for chaplaincy, for artwork, interpreter services, just kind of special patient needs and things that we wouldn't otherwise be able to provide. They're not covered by insurance. We're really proud too of the work that we're able to do with research and trials. So we'll be working even further with the Health Partners Institute moving forward on providing funding to make sure that our clinicians are able to do trials and that they are able to bring the newest and most cutting edge technology and research to the front line for health partners. So we're excited to be able to partner in that space as well. And then finally, volunteerism. We touched on this already, but we are everywhere within Park Nicollet Health Services across the Methodist campus, our specialty centers, our clinics, and TRIA. One piece that, again, is so remarkable about having over 550 volunteers is that they're onboarded and screened very similarly to a staff member. So when they are signing up to be part of our volunteer corps, they're really going through a pretty arduous process. We want to make sure that our volunteers are well trained, that they have the skills and resources that they need to be successful. And so it's amazing to me that we have so many really long-standing volunteers and folks who are willing to go through that process. And they do such incredible work for us. Many of our volunteers are grateful patients and or retired healthcare workers. We had lots of folks during COVID come out of retirement to give vaccines. We needed people who could do that work, and boy, did they come out of the woodwork to help us do that. So we're just so proud to have a space where folks really want to come and give of their time, talent, and their treasure. I am really astounded by this stat here that all of our volunteers, their time is valuable and is actually saving the organization significant funds. So last year, $1.9 million worth of time is how much our volunteers gave, which is no small number. So we're so grateful to all of our volunteers. So why support to the foundation matters? We ask folks to give. We ask folks for their service, their time, if they're willing to volunteer. We are always looking for folks to help be ambassadors for the foundation in the community. There's nothing more powerful than word of mouth, and then really having people in the community speak to the impact that we're able to have. And then finally, advise. We know that our community makes us better. And so when we're able to ask for advice and ask for feedback, and you all take the time to give it, that's incredibly valuable to us. In 2024, Park Nicollet Foundation will be doing a strategic planning process, and we're really excited to do that work. As you've heard, we've had significant impact in the community over the last 50 years. We are just getting started, and we are really excited to put some strategic parameters around that and figure out what do the next 5 to 10 years look like for the foundation. And so I invite you, those of you who are on or watching this recording, if you have feedback or thoughts about the foundation, we would love to hear it. This is really a unique opportunity to be able to think through what we want to be, when we grow up, if you will, and really are seeking the advice and counsel of the community. There will be some more formal ways to provide that feedback, but I do want to open that up for any folks on today or who will watch this recording that we'd love to hear from you. So this is a quote that I just want to share as I close out my portion of this, but every hour and every minute our work affects people's lives, and we lead with the passion, intelligence, and honor befitting that privilege. And it truly, truly is a privilege to be part of Park Nicollet Foundation and the Health Partners family. And I'm just so thrilled that you all took the time to be with us today. And I will take any questions that may have come in. Abby, I think you're moderating that portion for me.
Absolutely. Hayley, thank you so much for your wonderful presentation.
Yeah.
And for folks that have any questions, if you could just type them into the Q&A box, I can read them out, and then Hayley would be happy to answer them. Give it a couple minutes. And as Hayley had said, there will be a recording of this presentation, so you'll be able to watch it later on. And others that were not able to tune in live, they'll be able to tune in as well. Okay, we do have a question here. So Hayley, what has been the most surprising to you in your first 6 months? What has been most surprising to you?
Oh boy, that's a good question. I I'm gonna say it's both surprised and delighted me, if you will. So let's see if I can describe this. I have been so impressed with how the Park Nicollet Foundation does what it needs to do to get to a yes. We're very, very much a a group that wants to help and support. And so that comes with its pluses and minuses because we try to be all things to all people, which can be really challenging, but I'm also so proud of our ability to collaborate and figure out, if a request comes in that's kind of like, yep, we could do that, but maybe we have to think about it differently, or maybe we have to approach it differently. There is just a very deep desire to get to yes and to be able to help. And so I don't know that that's really a surprise. I think I kind of knew that that was the nature of Park Nicollet Foundation, but I have been just so delighted and proud of how that really is like a through line through everything that we do. Yeah.
Awesome, thank you. And then we have another one here. One moment. Let me see. Okay, could you share any grants the foundation has funded that have been particularly innovative?
That they have been particularly innovative. Yes. So I'm thinking of a couple. So first of all, we fund a lot of research and innovation. So I mentioned our Health Partners Institute will be. I'm hopeful that we can deepen that partnership even further. But we are absolutely right there with our clinicians, helping to figure out how do we fund the unknown, those things that we don't know about quite yet. So one example of a request that we've received recently is around nurse navigation. So this is unique and not everywhere, but nurse navigation is a person. So if you've been diagnosed with, in this case, the request is for diabetes. If you've been diagnosed with diabetes, but maybe don't have your A1Cs completely under control, or need some support, need some consistent glucose monitoring, need somebody to kind of walk you through that process, you might be assigned a nurse navigator, and that person stays with you through your journey. They're checking in with you regularly. They're partnering with you. They're calling you up and saying, "Hey, you know, we can see that your continuous glucose monitoring, it's been really uneven. These are some things that we might suggest to help get you back on track." That's new, and a lot of different healthcare systems don't have that kind of innovative approach to care that's not about coming in and seeing a person physically. While that's important, that's one piece of the kind of stool. But this kind of virtual, telephonic, online option is also really important for those interim periods. And so we're excited to be able to fund kind of those kind of pilot programs that are new and different. We also do fund a lot of clinician time for trials in general. So if a clinician is interested in a study of some kind, it's really difficult for them to pull away from direct care with patients. And so if we can help bridge that gap, we're happy to do that as well, and bring some of those new research pieces to life. So um, anytime that we have people that are excited about something that's different, we want to hear about it. And we're especially interested if it differentiates us from others in the field. I just had a conversation with cardiology a couple weeks ago. It's not that our equipment is different, it's the way that they use it that's different. And so I had a great conversation with them about how can we help fund that for you, or help fund the training of others to do this work in a really innovative way. There's a deep desire, I think, to not keep our knowledge for ourselves, but really to help better the field in general. And I'm proud that Park Nicollet gets to be part of that too. Great questions. Love it.
Yeah, absolutely. Thank you for sharing. I think there might be one more question in the chat here. Can we share this presentation across departments and stuff like that for everyone to be able to see?
Oh, yes, absolutely. Absolutely. Yeah. And if you're internal on this call and would be interested, someone from the foundation would also be happy to come out and talk to your teams about the foundation. And we're hopeful that in 2024, kind of in parallel with our strategic planning process, we're going to take the show on the road for Park Nicollet Foundation and really help spread the word about what we do. As I mentioned, if you're, again, internal on this call, there are funds available. And so we want to make sure that our teams are able to access those and know that they exist in the first place. Yeah.
Absolutely. Well, thank you and for your time, Hayley, and for your
Of
excellent
course.
presentation. Thank you, everybody, for joining us. And if you think of any questions after today, please feel free to reach out to us, and Hayley or another team member would be very happy to help you. So thank you so much, everyone. Bye-bye.